Hormone replacement therapy is a new type of therapy for both men and women. Dr. Cordestani from Amarillo Oral and Maxillofacial Surgery joins us today with more information about this hormone replacement therapy. And this is new. So who would this be good for?
It's actually very interesting. It's not necessarily new, but it has been approached with a new version now. And all these idea was like, okay, if something is good, more is better.
Right.
That we've heard that for many years. But now, as the studies have gone through, we've noticed that there are certain things, certain numbers, specifically let's talk about testosterone. Testosterone for males, translates into muscle mass, translates into cognitive function, translates into increased libido, etc. Well, as you get older, it tends to ebb. But when you look at people who are in their 60s and 70s, the number has dropped 40, 50, 60% compared to younger people. So the thought was like, if in fact we replace this, will the bad parts of aging go away? And as studies have shown that once you replace hormones, specifically testosterone in males, that the attention span gets better, the sleep gets better, the fatigue gets less. They tend to be better in workouts. They tend to recover from injuries faster. They tend to do better just in sleep in general, health in general, bone mass, body mass, less fat.
Can I sign up for it now? Like, I mean, you just kind of so that all those things are like, yeah, I'll get into that. But this is for men and women. Like this
is for men and women. The issue is, and I think you kind of touched up on, is yes, the data has been there, but the problem has been standards.
Okay.
So how much do we put in? How much is too much? How much is not enough? So that's where the issues have come across in the last couple of years. They've become a lot more standardized. So now, if you came in, and again, yourself or anybody else who is in their late 40s, etc. I don't know your age, Andy.
Well, you hit it. It's 46.
So when you kind of go through, the hormone levels definitely ebb. And again, males and females. Females come in and they go, something is not right. I don't feel like myself. Something feels off. And then you have a series of questions you ask. Through that, you see if that person is a candidate. Because if you leave it alone, anybody walking through the door will say, I want it. And that's not the way to do it.
So how invasive is it?
It's actually, once we go through the entire process, question, answer session, evaluation, etc., we actually take your labs, put it into an algorithm in the computers, and they actually generate pellets. And then literally for females, we make a small incision in the office under local, put the pellets in, close it up, and then recheck labs in a couple of weeks, and that's it. In the old days, they used to be talking about injections, drops, etc. Problem is there's a seesaw effect. A huge upkick because the effect's in, and then a huge drop.
Okay.
Which
so this is kind of slow release that you have them in there.
Exactly that. A pellet goes in, works, and then basically you've got a much more of a controlled distribution for 4 to 5 months.
All right. I mean, I'm curious about it. Listen, if you are too, and this is something that kind of sparked your interest, do me a favor. AOMS Plastics. Make sure you give them a call. 806-322-LIFT. That's 322-5438. Dr. Cordestani, always good to catch up with you. Glad to have you in, and I may need to set up an appointment. Sounds like something I could use. Up next, we're headed in the kitchen. Chef Bud is in. It is the perfect